2 years ago, LIST first looked at the major health impact of homelessness in the adult population of North Lanarkshire, and as a result, the partnership asked for further analysis to be undertaken to look at the impact on health and well-being of children who are affected by homelessness, and to understand what services and interventions need to be provided to limit the impact of this. The experience of homelessness introduces instability, insecurity, and uncertainty into a child's life, and there's evidence that the impact of homelessness on children can affect the individual into adulthood. Children experiencing homelessness are at a higher risk of abuse and neglect. Attendance and attainment at school are also affected by homelessness, where developing and maintaining friendships can be challenging, and the likelihood of experiencing bullying is believed to be higher. Children experiencing homelessness tend to have poorer health than children who are housed. Access to health services may be poorer due to the cost and distance of travel, being unable to register with health professionals due to temporary accommodation, and not receiving appointments due to frequent moves or change of address. Health inequalities between children experiencing homelessness and those who are housed are apparent across a range of health outcomes. The LIST team looked at 2 groups of children in North Lanarkshire. The HL1 cohort was made up of children under the age of 16, whose guardian had made an application for homelessness in 2016-17. There were 1,478 in this group. The other group was made up of children in the partnership area under 16 years of age, excluding the HL1 cohort. There were 61,281 children in this group. The demographics of these 2 groups showed a number of differences. The group made up of children experiencing homelessness had a higher proportion of under 5s, but a lower proportion of 12 to 15s. Both groups have a similar ratio of males to females. 46% of children had become homeless because of an adverse childhood experience. 25% where this experience specifically included violence. Looking at health conditions, it was found that there were high rates of breathing conditions and respiratory infections among children experiencing homelessness. Linked with these conditions was a greater use of out-of-hours services. There was over double the amount of A&E and emergency admissions due to breathing abnormalities in these children. Health visitors conducting 27 to 30-month reviews of these children expressed significantly higher rates of concern over speech, language, emotional and behavioural development than their North Lanarkshire counterparts. Children experiencing homelessness were less likely to be registered with a dentist, and for the 5 to 11 year age band, more likely to have had a tooth filled or extracted. Although the portion of 12 to 15-year-olds in the group of children experiencing homelessness was lower than in the North Lanarkshire group, the rates of referrals to child and adolescent mental health services was double. Across all age groups and genders of children experiencing homelessness, we see higher rates of attendance and referrals to health services, coupled with higher rates of non-attendance. 3 times as many 12 to 15-year-old children experiencing homelessness did not attend their appointments. We also see that children experiencing homelessness are less likely to take up preventative services, such as teenage booster vaccinations. To receive this vaccine, a child must be registered with a GP and attending school, both situations which are affected by homelessness. This study demonstrates clear inequalities in the health care that is received by children experiencing homelessness in North Lanarkshire, and it shows some of the difficulties in providing healthcare to this cohort. The study highlights particular changes to address in order to reduce inequalities of healthcare provision, alleviate pressure within the healthcare system caused by higher rates of attendance, referrals and DNAs, and ensure higher standards of health for this cohort as they grow into adulthood.